Hello, welcome to the Medical Minute. I'm your host, Michael A. Weiss. In approximately 10 years, baby boomers are going to start retiring. And when that happens, and some turn 65, they're going to want Medicare, but the sheer amount of people retiring at that point will cause Medicare to become bankrupt. So that's why we hear in the news these two very different Medicare plans, one proposed by President Obama and the other proposed by presidential candidate Mitt Romney and his running mate Paul Ryan. President Obama's plan derives itself from the Patient Protection and Affordability Care Act, which is known also as ObamaCare. Very simply, what that plan says is that certain providers, have agreed to accept less for their services, less payment for their services, and then in turn, the savings from that are going to be put back into Medicare to keep it afloat for another 8 to 10 years. It's very simple, and it's pretty much predicated on the fact that everyone knows that there are gross inefficiencies that currently exist in all of healthcare, not just Medicare. So that was really directed at taking advantage of fixing those gross inefficiencies, and providers agreed to do that. So that's what President Obama's plan is. One of the critiques, but it's not fair because it's inaccurate, Mr. Romney has had certain ads circulating on the web and on TV saying that President Obama is robbing $716 billion from Medicare. That's incorrect. What President Obama is doing is he is establishing a cost savings, which he thinks will be $716 billion, which is all coming from providers. It's not beneficiaries. The providers have agreed to forego higher fees, take less fees. The cost savings from that is going to equal $716 billion, and then President Obama is having that money put back into Medicare for the benefit of the beneficiaries, so therefore Medicare will last another 8 to 10 years. That's the reality of what President Obama is doing. Presidential candidate Mitt Romney and his running mate Paul Ryan have a very different approach toward addressing the Medicare deficit. And they are very clear that their plan does not take effect immediately, so it does not affect seniors. It will affect people who are retiring in 10 years, but it does not affect seniors. So I got to make that clear. But their plan is a voucher system or a subsidy system. They are somehow coming up with a fixed fee, a fixed number that they're going to give people who turn 65 and typically who would opt for Medicare, and give them a voucher or a subsidy that is worth a certain amount of money. And with that voucher, they can go and either opt for traditional Medicare, or they could go out into the private sector and get health insurance. It's very simple. The critique with that plan is that it's been proven time after time that healthcare costs consistently rise year after year after year. However, at least at this point in time, the subsidy or voucher that Mr. Romney and Ryan are proposing is fixed. So therefore, there's going to be a discrepancy between what the insurance will actually cost and what the beneficiaries are being allotted by the government. Now, from the government's perspective, the way this fixed figure has been computed, they will save a tremendous amount of money. The problem is that the seniors who are going to opt for insurance or even opt for Medicare, they will take that subsidy or voucher, but they will have to pay an additional fee so that they can get insurance. That's number one. Number two, when you're 65, you're likely to have very serious medical problems, or at least a medical condition. So therefore, getting insurance, if you do go out into the commercial world of private insurers, it's going to cost you more to begin with. So the combination of just age and illness coming with age and healthcare costs rising, it makes this voucher or subsidy system somewhat suspect. So those are the basics behind the two very different ideological Medicare deficit plans being proposed by President Obama and presidential candidate Mitt Romney and his running mate Paul Ryan.